Good afternoon. Thank you all for joining me today. I want to share my framework for restarting public life and business in our state, how we're going to approach reopening Oregon. This is only a framework, and its timing is dependent upon several factors. As Dr. Anthony Fauci says, we don't control the timing, the disease controls the timing. I want to be transparent with how we will approach this incredible challenge of reopening segments of our society while living with the virus, and how we will continue to maintain healthy communities. In the early days of this pandemic, I had to take swift action to protect the health and safety of Oregonians from this deadly disease. Now, as we see these efforts are working to flatten the curve, we are analyzing how and when to reopen each part of our society and our economy. And I want to work collaboratively with Oregonians to do that. But we have to be careful. As this diagram from our recent COVID-19 modeling shows, we have to be cautious or it will backfire. We know that a vaccine or an effective treatment may yet be months away. And if we move too quickly, we will see a spike in cases that could lead to an overwhelmed hospital system and the science dictates that we need to complete specific prerequisites. First, we need to slow the growth. We need to see fewer and fewer cases of COVID-19. The exact metrics will be informed by experts and by data to avoid a resurgence in the virus. Epidemiologists and my medical advisory panel are working on this right now. Second, we need adequate PPE, personal protective equipment, masks, gloves, and gowns. When we have enough PPE, we know that our healthcare workers and our first responders will be protected. Third, we have to establish a robust public health framework to support the reopening effort. The major components of this include: we need to ramp up testing capacity in every region of the state. Increased testing helps us make sure that we can identify where the virus is in our communities and stop it from spreading again. This will take really strong partnerships between the private sector and the public sector. Second, we need to develop a robust system for contact tracing to identify those who may have been exposed to the virus, and of course, to stop further transmission. OHA is working to develop a plan that works for every region in partnership with county public health departments and our local health systems. We also need an effective quarantine and isolation program for people who test positive. It will need to include strategies for nursing home residents and address the needs of people experiencing houselessness as well. And we need this in every single region of the state. These are the prerequisites necessary for when we can reopen. Then there's the how we reopen Oregon and keep it open. These are the key elements of the framework: slow the growth, more PPE, testing capacity, contact tracing, and a quarantine and isolation program. It's not going to be easy, and it will take longer than we want. Like the rest of the world, we will be actively monitoring the availability of both treatments and vaccines that might affect the structure and the timeline. But for now, this is what we have, and this is what we can do. Now, I'd like to talk about how we're going to approach the finalizing the details of this public health framework. Moving forward, my plan is to hold discussions with leaders across the state to discuss the plan further. We will gather input from healthcare professionals, public health experts, and from industries substantially impacted by the stay-at-home order. We will take a look at specific sectors of the economy: restaurants and food service, retailers, childcare, and personal services like hair and nail salons. We want to bring together business owners and practitioners with health professionals to discuss how reopening gradually in these sectors might be accomplished. For example, this might include additional guidelines for reconfiguring the delivery of services with additional physical barriers like plexiglass dividers or requirements for wearing PPE. I also want to add that California Governor Newsom, Washington Governor Inslee, and I will be working to coordinate our efforts. This virus doesn't recognize state boundaries. We have to work together on a plan for reopening, and we'll be talking regularly and sharing best practices and processes with our neighbors to the north and to the south. In closing, I want to say, while that we have to be careful, we also cannot stand still. We all know this is a global problem, and leaders across the world are wrestling with how to approach this. The shuttering of an economy at this scale has never, ever happened before. Likewise, the reopening of a shuttered economy at this scale has never, ever happened before. I will continue to make decisions based on science and facts in consultation with public health experts and epidemiologists. So far, through the sacrifices of thousands of Oregonians, our collective actions have had a major impact. Thank you. And I know that together we can and we will get through this together. I also want to add the following. After the last Great Recession, the recovery was really uneven. Certain people and industries benefited, and many, including folks living in rural Oregon and communities of color, did not. Today, many of our heroes are low-income workers in grocery stores, nursing aides, and our truck drivers. But many more, from cooks and dishwashers and waiters to hotel housekeepers and salon stylists, have lost their jobs. In many of these sectors, these jobs are held predominantly by women and people of color. Our efforts at reopening Oregon and addressing this virus must reflect this reality. As we prepare in the months ahead to get Oregon back to work, we must remember the importance of doing so in a smart and deliberative fashion that keeps us moving forward instead of sending us backward. This is going to move slower than any of us would want, but it is the only way to protect the health and lives of Oregonians. With that, I'm happy to take your questions, and I'm inviting Dr. Dean Sidelinger and Dr. Bruce Goldberg to join me. Thank you. Dirk, go ahead.
Yeah, I think people will be listening to this and probably want some specifics. I know that some of those are being worked out, but you talk about PPE. I mean, do you have a sense of how much PPE will be necessary? How much surge capacity? You mentioned the KGW, no deaths in 10 days. Is that still a metric that you're going by? So some concrete details could be helpful.
Sure, thank you very much. So the question is, could you give some more concrete details? And you used an example, the KGW fact that I shared with Pat Doris yesterday. So I used information from Dr. Deborah Birx. I used the criteria that she had. Oregon, of course, is using our own framework and relying on epidemiologists, public health experts, and data here. And my 5 metrics are: slow the growth of the disease, adequate personal protective equipment, testing capacity substantially increased, tracking or contact tracing, and isolation. In answer to your question about PPE, we honestly don't know how much PPE capacity we need. And we are obviously collecting the burn rate, the use rate, at hospitals and clinics around the state right now. But that's only one component. For example, we might need personal protective equipment on people who are doing personal services, therapy, for example, hair salons, for example. We don't have a sense of what that need is, but we can certainly use modeling from centers like Oregon Health Sciences University to determine those numbers. We do know that we need more. Dr. Sidelinger, do you want to add anything to that?
I mean, in terms of surge capacity too, Dr. Sidelinger, I mean, do we know what is adequate at this point?
So do we know what's adequate for surge capacity as well as PPE? I think what we've seen is our hospitals have come together and we've built in some surge capacity. So part of that was shutting down many non-essential services, saving the PPE in those facilities for those who might be ill with COVID-19. What we've seen is that we have adequate capacity in Oregon right now to handle the cases we have. Those cases, the new cases that present, as well as the admissions to the hospital, are staying relatively flat. And our modeling predicts that if we continue the actions we have now, that will continue to be the case through mid-May. We look at the PPE that we have, and as Governor Brown said, we are getting better information and more information from the hospital systems about the PPE they're using. But we know that in order to open up, one of the first things we need to do is look at those non-essential services that people have postponed while we've shut down much of the healthcare system. And these are procedures that keep people out of pain. Fixing their knees if they tore their ACL, hip replacements, other things that are urgent for those patients who need them, that we need to get back into the queue, and those take PPE as well. So we are committed to looking with our hospital systems, with our dental partners, healthcare partners, those other partners that may need this personal protective equipment because of services that are living in the home, and get a number of how much we need so that we know that we have adequate capacity and we don't need to shut down because a certain shipment doesn't come in. PPE is becoming more available, but not nearly as available as Oregon or any other state wants. So I think those things are coming into place, and we'll share additional information as we get it. As for the metrics to reopen, it really is going to look at flattening the curve. Are we continuing to see decreased new cases every day, decreased new admissions to the hospital, so that we know that what we're doing is having an impact, that we're not seeing the beginnings of a surge before we even open up, so that then we can take those next steps.
I believe that I was citing at the time Dr. Deborah Birx, and that was information that she provided in a White House briefing a week and a half ago, and we're using different metrics here in Oregon. Go ahead.
So experts are saying that there needs to be increased testing as well as the ability to track and trace new cases. When will the state be able to do that?
That's a great question. I can tell you that we have substantially and gradually increased our testing capacity in the state. We're doing roughly 7,000 to 8,000 tests a week. We're incredibly grateful for all the partnerships that have been created to make this happen. And I'm happy to let Dr. Sidelinger add further. Will you repeat the question? Yeah. Sorry, I forgot to do that.
About testing capacity and what are we looking at in the state. I think first I want to say that, the testing capacity we're looking for isn't the ability to test every single Oregonian. Because we know even if we did that today, we could say who doesn't have COVID-19 today, but that doesn't mean that tomorrow they wouldn't test positive. So we've really focused on those with symptoms, and even now those who are outpatient and mildly ill are starting to get tested. And what we're seeing is that even as we've increased testing throughout Oregon, we're still only identifying about 5% of those tests being positive. So, we're not seeing rampant numbers of people coming in and getting tested and picking up more and more. It's staying relatively constant. We do anticipate, up to around 15,000 tests a week with what we would need ongoing. That's a rough estimate. As we, see the cases continuing to decline, we'll have less people with symptoms. We know that many people don't have symptoms, and that's why we're working across the state to develop a strategy that will look at surveillance to see how widespread is this. And and that could be with doing testing on kind of samples of asymptomatic people, because we know that they are one of the ways that the disease is spread. But it would be impossible for us to test every single person in Oregon who didn't have symptoms and say, here's the picture right now, because again, it would be a picture in time and we'd have to continue to do that. So our capacity is getting there. We've seen slow increases over the last few weeks. They're not as quick as we'd like, but we anticipate that capacity will only continue to grow, and we've developed some great coordination amongst the different systems and the different folks who are testing to try and make sure that everyone in Oregon who needs a test will have access to that in their communities.
Timeline to when it gets to 15,000 tests?
If I could predict the future, I would be doing a lot of other things. I think the increase in testing really has continued. We know that our hospital systems who are currently doing testing are working at increasing capacity. Our Oregon State Public Health Lab is always looking at ways to increase capacity. We've heard that many of the large commercial labs are able to deal with their backlogs. All of this is dependent on several things: the adequate personal protective equipment to collect those samples, as well as the collection kits and the reagents, the chemicals that are used in the lab. Throughout this whole response, we've seen shortages across all of those areas, and it's hard to predict when those shortages will arise and in which system they'll arise, so we continue to work to try and increase all of the supplies throughout the system so that we know that we have a steady testing supply and the ability to test those who present for care who need that test. And I can't give you a specific timeline, but we know if the last few weeks are an indication, those will continue over the next few weeks.
And I just want to make sure everyone in the room has a chance to ask a question before we move to the phone lines. Well, I do have one more question for the governor. You know, it was hard to tell yesterday what was practical in the three-state announcement and what was political. My understanding is you all have been in conversation definitely with the Washington governor's office quite closely, and maybe with California as well. So help us understand what it actually means that you're talking to these folks, and if there's something more practical there, or if you're just sort of making a show, Washington, D.C., that the West Coast is getting together.
Well, as you know, Dirk, we have been working and I would say texting closely with Governor Inslee and the state of Washington, their public health officials there. We've been sharing best practices. We certainly have been giving each other the heads up. And I think what that's saying is that this work will continue. As you know, the disease knows no boundaries. And we have folks who work in Oregon and live in Washington, and obviously the reverse, and the same is true with California. It's really important. The states have been on the front lines of this disease. We have made the very difficult decisions in terms of how and what to shut down. And we're simply coordinating efforts. We're sharing best practices. We're sharing information and sharing resources. That's no different than what we have done in other circumstances, for example, wildfire. And I think it's really important. We're all impacted by this virus. We are all in this together, and I think it's critically important that we all work together.
But just as a practical matter, it sounds like you're just saying yesterday we've been talking and we'll continue talking, and there's not much else different?
I think you'll see a higher level of coordination and alignment in terms of how we take actions. But is our framework going to look the same as California's framework? Absolutely not. Obviously, we're different regionally and economically, but we want to be coordinated and in alignment.
And is there any talk of bulk purchasing of PPE, for instance? I know Governor Newsom has mentioned that.
Yes, that's certainly been a challenge. You know, personal protective equipment, we are competing against other states who are larger than we are. We're certainly competing against some of our folks in the medical industry, and I think to the extent that we could coordinate those efforts, that would be extremely useful. I don't know if Dr. Sidelinger has any further information on that, but we think it would be really good for us to be coordinating our procurement efforts. I just want to add, my team, this administration has worked really hard to make sure that we have adequate PPE, personal protective equipment, for our frontline workers, our healthcare workers, our first responders. We've done that by collecting PPE, and we're really grateful for the veterinarians, for the dentists across the state who donated their personal protective equipment. We're asking folks to conserve their use of PPE, and that's been instrumental. But the other piece is we're working hard to create it, and this has been both public and private. to produce it. A couple of great examples. ADAC in Newburgh, they're a dental equipment company. They are now producing personal protective equipment. Renewal Workshop and Cascade Locks, they're also creating, I think they're producing gowns. But we also have our adults in custody that are producing 3,000 to 4,000 masks every single day. So this has really been a collective effort, and frankly, it's going to need to continue to be a collective effort.
I think we've got a lot of people queued up on the phone line, so if we want to take the first question.
First question is Noel Crombie.
Yes, good morning, Governor. On Monday, you received the information you requested from the Oregon Department of Corrections regarding possible candidates for early release from prison. Do you plan to release any inmates early in response to the pandemic? What is your timeline for that decision? And will you make public the information you received from the Department of Corrections yesterday?
In answer to your question, and the question was, do I plan to early release adults in custody as a result of the COVID-19 crisis? The answer is no, and certainly we will provide you with the documents that I have used in my decision making. Look, all of our state agencies are wrestling with the impacts of the COVID-19 crisis. I have asked all of my agency directors to share with me their plans for protecting their staff, their employees, and for protecting their customers, their clients, their adults in custody. And certainly am concerned about COVID-19 and the presence in our prisons in Oregon. I have reviewed the plan with Director Peters. They are working hard to make sure that our adults in custody and the staff remain safe.
Governor, Dick Hughes had a question to get on. Can the governor be more specific on timelines? At least saying it will be before X date.
So we made, these were very difficult decisions to make. And the question is, can I be more specific on timelines in terms of the reopening? And the answer is no. As I said earlier, as Dr. Fauci said, we don't control the timing. The disease controls the timing. Oregonians' efforts to stay home to save lives have been extraordinary. And I am incredibly grateful for the sacrifices that Oregonians have made to take care of their health, their family's health, and their neighbors' health. So I'm incredibly appreciative of that. These were very difficult decisions to make, and I know they have caused economic hardship in communities around the state. But this is not like turning on a light switch. It will be done gradually, incrementally, and based on science and data and advice from public health experts and epidemiologists. Dr. Sidelinger, do you want to add anything?
I think, as Governor Brown stated, you know, a specific timeline is difficult to get. We know that the sacrifices continue. People have lost their jobs. Small and large businesses are impacted. But we know from looking at the existing data of people who are being diagnosed right now, of people who are being admitted to the hospital, that that curve is flattening and what we're doing is working. We do modeling and estimations not to predict the future, but to help us plan. And when the modeling shows is that if the current activities that we have in place are continued through mid-May, we will continue to see a flattening of that curve and potentially a slow decrease in that curve. And that's what we're really looking for. So as the data, as what we're seeing day to day in terms of people presenting is going down, that's how we'll know that it's time to take the next step. Doing some planning, alerting you all ahead of time of the plan, that this isn't a kind of one-day thing where everything is turned on, but taking a specific sector-by-sector approach, working with those sectors to say, what do you need to provide protection for your employees, for your customers, so that we can make sure that we have those things in place so that when it's safe and when the the data, when the virus tells us it's time that we can lift these restrictions, that we'll be ready to do that together safely. We'll continue to monitor and see if we are seeing a resurgence across Oregon or in specific parts of Oregon, that we can turn these things back on again and do it in the least disruptive way possible. Though, as Governor Brown said, the disruptions we've made to the economy, to society, have been tremendous. And if you'd asked any of us, at the end of last year, if we thought we'd be in this place right now, none of us would have predicted that. So we will continue to provide updates and be as specific as we can, but a specific date is just not in the offing right now.
Next question.
Next question is Lisa from Point.
Yes, good morning. Two questions for the governor regarding assisted living and long-term care facilities. Will the state release full information about where the cases are in these facilities? Not names, obviously, but as far as the numbers of cases in all the facilities and how many deaths there have been related to these cases. The second question is there going to be aggressive testing done of staff and residents at these facilities?
Thank you, Lisa, for those questions, and I'm really glad I have a pen and a piece of paper up front. Two questions. Number one, will the state release information in terms of where the cases are and how many deaths? And the second question is, will there be aggressive testing done in our congregate care facilities? Before I have Dr. Sidelinger come up, I just wanted to make a couple of comments. This is really, really hard. I know that during this season of very special holidays for a number of our religions, that a lot of families get together across the state and across the country. I know it was hard to not be able to hug your grandchildren or hug your nieces and nephews on a holiday. I know it's hard not to do that every day. But I took swift and strict action to shut down our congregate care facilities, our assisted living facilities, because I know how vulnerable these populations are. I have a 90-year-old uncle in an assisted living facility. He had his 90th birthday. My family couldn't hug him and wish him happy birthday. They did an alternative. They did a drive-by birthday celebration with signs outside his window. But this is really, really hard for our families, and my heart breaks for all of our vulnerable Oregonians that are in assisted living facilities because they can't see their loved ones.
To add to that, I know that this has been a very difficult time for our residents and our staff and the families who have family members or who are in assisted living facilities. We've known from the start that the populations that are in some of these congregate settings are some of the most vulnerable to complications and death. And the tragedies that we've seen are horrible, and we wish we could have prevented them all. But we continue to work very closely with Department of Human Services, with our local public health authority partners. We've begun releasing information on the facilities that have had outbreaks identified and have worked with teams that have gone to those facilities to assess their infection control practices and other things. We're continuing to gather additional information that we hope to be able to release to you on the numbers of people in each of those facilities that have been impacted by this horrible disease, and we will continue to identify that information and get it out to you as soon as possible. So those updated facility information should be out this week, and we hope as we gather additional information on the specific cases and the numbers in those facilities that we'll be able to release that to you as well, because we know that's of great interest to the families who have loved ones in there, to the employees who are working in those facilities. But rest assured that we've been working very hard with the facilities, with DHS, OHA, our local public health authority partners, to assure that we have the ability to respond there. As for testing, we started off at the beginning of this epidemic with using a strategy that we've used for other respiratory diseases, to to identify when there was disease in the facility, do some targeted testing, and put people who are sick together with staff who cared for them and didn't cross over to the well people. As we learn more and more about how this disease behaves and the fact that more people have symptoms, that strategy is evolving, and we work on a situation by situation to do the testing that we need in those facilities across our local public health partners, the facilities and OHA, and with DHS to ensure that we are responding the best way possible to offer protection to the residents and staff who are in those facilities and reassurance to families.
Or individual counties have the necessary staffing or resources to do aggressive contact tracing. Do you have any goals for increased staffing, or how will the state address this disconnect between what you want to see and what the reality is right now?
Thank you, Simon, for your question. And the question was, what are the metrics and how will the state increase its capacity for contact tracing and I'll add isolation and quarantine in our communities around the state. The Oregon Health Authority is working on a plan to address these issues. I'd like Dr. Sidelinger to respond to that question.
Yeah, thank you for that question. I think, before this epidemic hit, our framework in public health has been public health modernization. So local public health, tribal health authorities, and OHA working together as a system, identifying the skills that we needed and then the resources that we would need to implement those skills. That has been supported by our leadership, the governor's office, and legislators as we've gotten additional resources in, and that plan is really setting us forward to respond to this current pandemic. We know that there's some skilled positions, some epidemiologists and others that have specialized training that we're going to need to identify and bring on board. That may be a process that takes some time, but we have ideas of what the need is there, and working with our local public health authority partners, our healthcare system partners, to find the most expeditious way to bring on that skilled work set. We also know that part of this response is going to be communicating with those who are isolated at home or quarantined at home while they're waiting for a test result to come back, and that we need to check in on them regularly, see what they need, see what their symptoms are. That can be a workforce that doesn't have to be someone with an MPH, but that's working very closely with our local public health partners, with us here in the Public Health Division in OHA, and skill sets that they need to deliver kind of community health worker type services. We know that there are great groups of community health workers out there that are employed by our healthcare systems and community partners, and I think building on that model and really combining that model with public health is something we're thinking about going forward. That workforce will be a little easier to expand and bring up, and I think that model will serve us very well going forward, not just in response to this pandemic, but to other issues that come up, whether it's communicable diseases or some of the broader issues that face the citizens in Oregon. The economic impacts of on health are great, and this workforce can help public health in responding to that. So I think this is an opportunity for us to really think outside the box, develop this hybrid workforce that doesn't just look like what it does today, but evolves to meet the needs of Oregonians.
Yes, Governor, thank you. I was speaking with the director of the Lake Hospital District yesterday, and he is of the belief that you need to start opening things up for rural Oregon soon. He is concerned about the crying wolf effect, that if you keep folks in different parts of the state following these social distancing protocols for too long, that they aren't going to want to follow them much longer.
So the question is, are we going to take a geographic approach to reopening the state? And I think the answer I would give is yes, that is one of the things under consideration. But what has to come first, and this is the prerequisite, right? We have to be able to slow the growth rate of coronavirus cases. We have to have adequate personal protective equipment. We have to have testing capacity. We have to be able to contact trace or track, and we have to be able to isolate and quarantine so the disease is not further spread. But certainly geographic locations will be one of the factors that we will consider moving forward. I also want to add, I know particularly that our critical care hospitals in rural Oregon are suffering as a result of the shutdown on non-urgent medical care. Obviously, we would like to get those open as quickly as possible, along with dental and other medical providers around the state. What we need to have in order for that to happen is adequate personal protective equipment and, of course, additional testing capacity. So we're working on it. Next question.
Lauren, are you there? Lauren, you're live. Do you have a question? Okay, we're going to go next to Brad Smith. Brad,
Hi, Governor. Hi, doctors. Yes, can you hear me?
Yes.
Hi, Governor. Hi, Dr. Sidelinger. The audio cut out. Did you say that the goal is 15,000 tests or 50,000 tests per week? And could you address how you think that we can get there? Our testing numbers have plateaued over the past 3 weeks, and while I understand your goal to get there, I'm wondering if you have an actual plan for how you think we can reach that testing number.
Thank you, Brad. Since Dr. Sidelinger answered the last question on that, I'll make sure that he answers this question on that. Thank you.
Thank you, Governor, and thank you, Brad. The number was 15,000, 1-5, and that's an estimate based on what we're seeing in other parts of the country and what we think would be necessary with the number of symptomatic cases appearing to level off here in Oregon, and those presentations to the hospital also leveling off, and we hope decreasing over the next time period. That leaves us the ability to have some tests to do surveillance so we can look for how is this disease behaving in our community and doing some testing of asymptomatic people. The current players that are testing right now, I think, will be how we will increase capacity. We are continuing to look for ways to increase capacity at the Oregon State Public Health Laboratory. As we've said many times, that's a specialized laboratory that's really supporting some of our public health response. Initially was doing testing for those patients who were hospitalized when hospital systems weren't up. And so we're continuing to look for ways to increase that. We know that our hospital systems are also looking for ways to increase their capacity. And with some of our hospitals who use a rapid PCR test, not the point of care test, but another system, that those systems are coming online over the next few weeks. There's a point of care system, the Abbott ID Now system, that is used by many providers for influenza testing in regular flu seasons, that now has the ability to test for COVID-19. The Federal Health and Human Services has provided 15 of those machines to the state of Oregon. The testing kits that go with those are extremely limited. So those have been distributed to some of our rural hospitals, and we'll continue to provide supplies to augment their testing capacity. And as we receive additional testing kits, which we hope will be over the next weeks, we'll be able to deploy additional machines there. Our commercial lab partners have informed us that their backlogs are gone and that they're able to test in a more timely manner. We know that with transit time to those labs that particularly may go make a couple stops before they get there, the timeliness of those returns isn't always there, so we'll continue to monitor that. But I think across all those pieces of the system, we're going to see incremental increases in that testing, and that's how we expect to reach an amount of 15,000 per week. We may not use all of that if the disease continues to decline in the community, but that's our capacity that we're aiming for so that we know that we can provide timely testing to those who need it.
Mr. Long, are you there?
Mr. Long,
ahead, Peter.
Okay, this is for the governor. National Governors Association on Saturday called for $500 billion total in aid to states that would be included in a follow-up federal aid package that Congress is considering. Can you speak specifically to the state's fiscal status and whether Oregon is going to need that aid very soon? Thanks.
Thank you, Peter, for the question. The question is Oregon going to need a portion of the $500 billion, which hasn't been promised but been requested by the National Governors Association from our federal government? The answer is yes. The financial assistance that we have been provided so far has been helpful. As an example, we were able to work with the Region 10 FEMA Director, Mike O'Hare, to provide additional funding for the Oregon Food Bank. But as we all know, the need is dire. And I am really focused on how we can keep people in their houses through paying rent, mortgage, how we can make sure that people get adequate food, and how we can ensure that Oregonians have access to health care. And so those are my top priorities. In terms of the fiscal situation of the state, we will have a revenue forecast out mid-May. But this is going to be a very challenging financial time for the state of Oregon. We are being impacted by a loss of revenue because there are very few folks working. The need, as I mentioned, is great, both in terms of our public health capacity and in terms of our safety net. And, of course, unlike the federal government, the state of Oregon has to balance our budget. So we will continue to work. I will continue to work closely with legislative leadership and our partners there to address the fiscal realities. But I certainly want to say thank you to our federal delegation, Senators Wyden and Merkley, and the congressional team for their incredible efforts to get as much resources to Oregon as possible. The challenge that all of the governors are having are the strings that were put on the earlier federal resources, and we would like all of us. This is one area where governors are totally and completely aligned, whether we are Republican or Democrat from a red or blue state. We would all like to see much greater flexibility in terms of the federal resources to support our financial needs in our states. Well, thank you for the question. And the question is, how would I respond to President Trump's remarks yesterday that he is in control? Here's the reality of the coronavirus situation. We are all in this together. And the states are truly on the front lines. And we have been addressing the needs and the issues around personal protective equipment, testing capacity, and of course, hospital bed capacity. Governors were also the folks that had to make the very tough and hard decisions to shutter parts of our economy. And I think it's really important that those of us who are co-located regionally, that we work together, that we align our efforts as we work to make this a hard task of reopening our economy. We do it together. Fedor, yeah.
Fedor, are you there?
Dean Tyler and Governor Brown. Governor Brown, when did you learn about the cluster of deaths at healthcare at Foster Creek, and why was the cluster not announced at the time? Thank you.
So, Fedor, thank you for the question. I was gravely concerned about the vulnerability of our Oregonians living in congregate care facilities, and that's why I took swift and strict action early on. We were one of the states to act first to protect our vulnerable Oregonians in our congregate care facilities. I see those reports daily and have been aware of the clusters both in Southeast Portland and the cluster in Lebanon at the Veterans Home there. I want to say I appreciate the Department of Human Services and the Oregon Health Authority taking action. We obviously would wish that that we had lost no one in these congregate care facilities to this horrible disease, but unfortunately that is the case. And I just want to say thank you for the collaborative efforts that DHS and OHA have taken to both prevent, detect, and implement stricter measures in congregate care facilities around the state. Dr. Sidelinger, do you want to add?
Thank you, Governor, and thank you, Fedor. And while I can't recall the precise date I heard about this case, we do know that as cases are identified, typically as part of our local public health authority response, when positive cases come in and they determine if those are connected with a congregate care facility, those are included in our internal discussions about the new cases that we identify and what responses we need to take. We had identified early on, as the Governor said, taking aggressive actions and limiting visitors. At the time, we also set up the ability to have strike teams go out and either virtually support or in person if needed, support the infection control and look at the policies, procedures, and what these facilities were actually doing to protect their residents and their staff. And so that happened shortly after each facility was identified that we work with that team to determine what are the needs for that facility. When they're DHS regulated facilities, we're in close communication with our DHS partners, and all of these congregate facilities fall under their regulation, but we continue to work together to provide what's needed to adequately respond. And unfortunately, we've not been able to provide every vaccinated facility. And we'd love to see more that's emerging, but we know these are some of our most vulnerable populations. Actions are taken early, and we continue to take those actions. Continue to work with those facilities, and that's what our things that happen all in all, and the partnerships that happen, and we escalate our actions based on the situation on the ground, which is what you're seeing right now.
And we have time for just about 2 more questions. We'll do one more from the phone and then come back to the room.
Yes, good morning. Governor, I know you're reluctant to put a date on the calendar for unwinding some of the restrictions, but it is good for the public to have at least a general perception of when things may start to loosen up. And I think from what I'm hearing Dr. Sidelinger say, that might be mid